Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, proud to be here with my guest, Rafael López from Diagnostikare, CEO and co-founder. Thanks for joining me today.
Thanks, Logan, for having me here.
Rafael, you are unique in our community in innovating within Mexico, okay? So I want you to start by just giving us a macro understanding of the Mexican healthcare system that you're innovating within, and then more specifically where digital health stands today.
Yeah, absolutely. I mean, Mexico is a challenging country like any other emerging economy in terms of access to care. It's 120 million population. Thing is, 1/3 of that population is lacking any sort of access to care, both from a private or public perspective. No wonder why out-of-pocket costs are on the rise. We're amongst the highest countries in terms of out-of-pocket healthcare expenditure. This means people having to pay from their own to get cash, to get basic healthcare like consultations or even medications or lab testing.
Yeah.
On the other side, there's also a challenge around chronic diseases.
Yeah.
So 75% of the population is either diabetic or facing high levels of obesity. So obviously when you look at this like 10,000 feet above the ground and in perspective, it's a recipe for disaster if it's not treated promptly. No?
And what are some of the real world ramifications of that system in terms of people not seeking care, going bankrupt because of expensive care, dying early? Like, what are some of the downstream effects?
I mean, the thing is, the whole healthcare system as a whole has become mostly reactive rather than a preventative model. No? So people are chasing the illness or wanting just to put some band-aids into certain situations as opposed to being able to prevent or leverage any other sort of strategies that can lead to cost containment and ultimately healthier lives and ways of living. No? So part of what we've been trying to do is promote a very strong preventative approach to our solution in a way that people start to become more aware of how preventing care will always be way cheaper than treating any sort of future conditions. No?
Well, that's a good lead-in to what exactly you're doing with Diagnostikare. You know, you've described a challenging macro environment, but for an entrepreneur like you, that means there's opportunity within the challenge. So talk to me exactly tell me what you've built.
Absolutely. So yeah, we thought from the very beginning, maybe 3.5, 4 years ago, the way to go was through partnering with different stakeholders in the system to make our service available to as many people as we could. Now, at the moment, we cover over 200,000 lives having access to our solution. And we thought that the right way to do it, and I mean, time has proved us right, was to either partner with employers. No? For us, organizations have a pivotal role in society and in economy, not only about creating more money or value, but also ensuring that their employees are well looked after, and they are actually having access to well-being and care solutions. So our main key prop relies on offering our well-being and primary care programs to employers, all sizes, all shapes, but we've realized that the people that benefit the most from what we do are typically operational workers or blue-collar workers that would lack, if it wasn't for us, access to any other sort of care. They might rely on public healthcare system, but they see it as inefficient, or they might have to wait a lot of days to get care. So that's where we come in. And we also started to work with insurance companies as well. Now, the insurance market is picking up in terms of finding digital health solutions like ours, very different from what it was maybe 1 or 2 years ago. And this type of companies, even though it's only less than 10% of the population in Mexico having private healthcare insurance, you're still talking about millions of people. Yeah. Therefore, insurance companies are finding ways as to how they can speed to market solutions like the ones we've built or keep building. No?
Okay, let's get really tactical and specific about the platform itself. Let's say that I'm a worker at McDonald's. I know you've done a partnership with McDonald's.
Exactly.
It's an opportunity for them to provide this digital health solution. Let's say, is it only for primary care? what types of things does it cover?
Yeah, very good question. So we try to make it as simple as possible for our patients to engage with us. So typically when they get into our platform, they can pick between two paths. One is, I want to keep myself healthy, and I want to pursue a healthier
Preventative
lifestyle.
care.
Exactly, so that's where we lead them into preventative care programs, are offering around mental health and even well-being and nutritionist support. And the other path is a more reactive approach. Exactly, I'm sick, I need to speak to a doctor.
Okay.
In both cases, they have to go through our AI-enabled intake processes in which we collect real live information about the patient, what are their symptoms, what is that they are actually experiencing at that point in time before actually suggesting the next approach.
Okay.
These suggestions can come in the form of a virtual visit with one of our clinicians or suggesting them to engage in one of our programs. One thing that we're working now at the moment is, after seeking lots of feedback from our thousands of patients, how can we drive our new program offering around well-being, stress relief, even, how to eat healthier or engage in a much more healthier lifestyle, no?
How are you finding people responding to the preventative health side of your platform?
I think, preventative care has always been a challenge, especially in countries like Mexico. No wonder why the chronic disease rate is always on the high, unfortunately. For us, it's around how do you transmit certain data or aspects to patients so that they realize
nudges.
They need to
pushes.
They need to engage into preventative care. So this could be around, did you know that by only exercising for 30 minutes a day, you could reduce your chance of getting a heart stroke by 40%? No? Yeah. Key facts that are actually eye-opener for our users in order for them to say, okay, I'll give this a go because it seems that the outcome might have a significant impact in my life. No?
Interesting. So what's next for Diagnostikare? What are you excited about in terms of new partnerships or traction?
Excellent. Yeah, so we are, this has been a pivotal year for us in terms of partnerships and the type of companies that we're working with. No? As I said, healthcare is about building an ecosystem, creating long-lasting partnerships. So we see a lot of opportunities from a distribution channel space as to how we can make more people benefit from our solutions. So, expect new exciting information in the next few weeks around some partnerships that we're crafting. And also from the product side, just as I was saying, we've been gathering tons of patient data and insights to shape our offering around more proactive type of programs. And we want to be there for our patients, not only when they are sick, but to make a relationship that can last throughout the year. Even if I only get sick once or twice a year, they know that they can come to us to solve any healthcare doubt, needs, whatever. So we're working a lot on the proactive, preventative scope of programs. And these are programs that will have a very defined objective or target that I want to work as a patient with a start date, a finish date, and then our companionship along the way. So it's exciting times ahead for us.
That's very cool. Last question. Something I love to identify is leapfrog opportunities where when you're innovating in one country and you're able to come to a place like HLTH or wherever, and you're able to say, you know what, they're doing something similar to what I'm doing, but you know what, we're actually going to tweak it for our environment, and we're going to jump over some of the challenges that they've had. Have you had the opportunities to sort of see actually mistakes that have been made or things that you could improve on in Mexico?
Yeah, this is a very interesting topic as well, because obviously you need to start taking a bit of perspective as to which market or country or region you're focusing on. No? Certain healthcare issues that mostly US-based companies are trying to solve might be completely different from an operational perspective or even from an economical or regulatory perspective than the ones we face in Mexico. However, let's don't forget, it's all about how do you increase quality of living for people? How do you make patients
Yeah.
healthier, or even, I mean, how do you reduce costs in serving care? So for us, it's super interesting having like open eyes and a broader perspective of what's going on in terms of solutions. And even though they might not be a plug and play component for take them into Mexico or learn from what has worked or hasn't worked in other markets, it definitely gives you perspective as to how you could improve patients' lives, no?
Love it. Rafael, I appreciate you stopping by the studio,
Thank you,
giving me this
Logan.
update. It's exciting to see the partnerships that you're forming, and I'll be looking out for those updates coming soon. So
Excellent, yeah.
keep up the awesome work.
Appreciate it.
All right, thanks a lot.
Take care, bye-bye.
Be well.